Hello, I'm Rebecca Linssen, the Group Editorial Director of MA Healthcare and the editor of the British Journal of Hospital Medicine. I'm going to talk to you today about writing for publication in healthcare journals. So why might you want to write an article? There are lots of different reasons. Because it's a topic you feel strongly about, because you want to relate the experiences that you've had in a particular situation so that other nurses or healthcare professionals can benefit from your experience, because you got an excellent mark for a paper and your supervisor said that you should get it published, because you want to see your name in print, because it'll look good on your CV, because the editor has asked you to write. So what might you write? You might want to start off with something smaller than a full article. So, for example, a letter to the editor about an article that's been published in a particular journal, a book review, or a filler article, depending on the publication you're looking at. If you want to write a larger article, there are a few things to think about. Write about something that interests you, a topic that you know a lot about. Write about what you know. You could write a case study about a patient that you've treated. You could write about specific treatments or procedures, developments in service that you've implemented or been involved in. You could write a full research article, or you could write a career profile talking about your work and what you've been doing. Set yourself a question that you're going to answer with this article. It's very important when you're thinking about writing an article to think about who you're writing for. Who's the audience for the article that you're writing? Is it your colleagues? Is it your peers? Is it people in other professions that you want to explain about what happens in your profession? When you're thinking about this, then think about which journal those people would be reading. Do some research about that. The journal that you plan to write for will affect the whole way that you write the article. It'll affect the style of writing, it'll affect the structure of the article, and affect the content. It's very important to remember that you can only submit a paper to one journal at a time to ensure that you don't end up with duplicate publications where the same work appears in two different journals. This is publishing malpractice and is really badly received. It's very frowned upon. So you must make sure that you only submit to one place at a time. Research your journals carefully because journals have different aims, they have different audiences, and they have different requirements for their articles, even in terms of word length, referencing style, this sort of thing. Targeting a specific journal from the beginning of your writing process means that you'll ensure that your work fits the requirements of that journal, which gives it a much higher chance of being published. Quite often, you'll have already written a course assignment and your supervisor will say, "Oh, that was really good, you should get it published." This can be quite difficult. Turning an academic essay or a dissertation into a journal article needs careful thought and planning, and actually you might be better just to start from scratch. You're likely to have a different audience. The guidelines for the coursework are very likely to be different from the journal's author guidelines. Journal articles need a specific focus, whereas coursework might cover several different themes. And there might well have been developments in the area since you first did the research for your coursework. If you've got any questions about whether your article might be suitable for a journal, then get in touch with the editor. We're always happy to hear from people. We're always happy to discuss ideas. So make sure you have the correct contact details. This can usually be found online or in the journal. Have a clear idea of what you want to write. And an editor may well be able to tell you whether your suggested article will fit the journal's scope and the journal's aims based on a proposal or an abstract. Or they might want to see a fuller outline or even a first draft of the article. Or they might read your details of your article and think, actually, that fits us really well, and ask you to go ahead and submit it to the journal. If the editor feels it's not appropriate, they may well suggest some other outlets for your work. If not, then you need to consider, do you want to target a different journal? Or actually, is the journal the right place? And so do you maybe need to think about a different type of article or a different content for the article for this particular journal? So when you've done that and you know you've got the right journal, formulate your outline. First of all, think about the abstract, because this will be the first thing that a lot of people read. So it's really important that it's thorough, that it's engaging, that it explains clearly what you're going to talk about. So what is your question? What do you already know? And then why does this question need to be answered? So what are you adding to what is already known? What is this article telling people that they don't know from current knowledge? Make a plan. Have a clear plan, have a logical structure to the article. This is a good point to get some input from other people. So if you've written down all the ideas, sometimes just getting someone else to have a look at it and read through and make sure that it flows clearly, that you haven't missed anything obvious or you've gone into too much detail about a particular area can be really helpful. Draw up an overview of these points and look at how they fit together. And break it down into subheadings. Subheadings are really useful for readers, but they're also really useful for writers. They help you to make sure that you're covering all the relevant areas in the right order for your article. Then think about the structure of the article. The introduction isn't the same as the abstract. The introduction is more of an introduction to the area that you're discussing, whereas the abstract is an overview of the whole article. Don't cram in all the background to the area you're discussing. Highlight the most important parts and the bits that are most relevant to your audience. In the body of the article, you then develop your argument, you present the evidence. It may be for and against, there may be evidence that supports a particular part of it and evidence that argues against it. It's important to include both and discuss how you can then assess what that tells you for the particular area you're discussing. Some types of articles have set frameworks. For example, if you were writing up a piece of research, you would do that in the standard research format. The conclusion, again, is not a summary of the article, but you're drawing conclusions about what you've shown. Importantly, for a lot of healthcare titles, is the implications for practice. So what does this mean for nurses or other healthcare professionals who are working in that area? How is this going to change the way that they treat patients? And also areas for further research. You've talked about what we know, but it's also useful for people to think about what might be coming in the future in this particular area. Then you need to think about the journal's house style. Each journal has its own house style and conventions, such as the way that references are formatted. You don't need to learn the house style, but it's a good idea to have a feel for how the journal communicates with its readers and try and make your article fit in with that. Reference formatting is an important thing to make sure that you get right. In terms of the peer review process, it's very helpful for reviewers if the references are in the format they're expecting for that particular journal. It makes them more able to assess the article properly and how it fits in with that particular journal. Use straightforward language. Long words don't make an article sound more impressive. They make it harder for people to understand what you're saying. And also don't use jargon, because while you and your clinical team who work in this area all the time may have a shorthand that you use or may use abbreviations quite often, if readers in different specialties or readers in different countries are looking at your article, they won't necessarily understand what you mean. So make sure that your article is accessible to as many people as possible. When you use abbreviations, when you use measurements, these need to be explained. Again, similarly to using jargon, just because you and your team use an abbreviation all the time doesn't mean that everybody knows what it means. And the other point with abbreviations is that there could be a number of different abbreviations for the same two letters. So, for example, CT could be computed tomography, or it could be carpal tunnel, depending on the context. So just because you know what you refer to as CT doesn't mean your readers necessarily will. An article should always be able to be read by someone without having to go through everything on the reference list, and they should have a feel for what that means for their practice. So have a think about that when you've written it, have a read through and just make sure that it's clear. Try and anticipate the reader's questions if you can. So maybe give yourself a bit of time after you've finished writing and then have a think about, okay, if I'd read this, what would I be asking? What's next? And if you can address those, then do. Editing your own work can be a very, very difficult thing. You know what you've said, you know what you think, you know what you understand, but have you actually communicated that clearly to people who don't know as much about this area as you do? Get your ideas down first and then edit them. Sometimes refining and polishing an article can take as much work as planning it or writing it. So allow yourself plenty of time to do that. You'll spot problems better if you can put the article aside and come back to it with a fresh eye, say after a weekend or a few days later. And I would always recommend asking someone else to read it, even if they're not a specialist in your area. It will help to make sure that you've communicated your ideas clearly. When you've done this, check the word count for the instructions to authors, check the spelling and the punctuation and the grammar, and check it again. It doesn't reflect well on your work if an article has typos in it. It makes people who are reading it, it makes peer reviewers, it makes editors think that you're slapdash and you haven't put enough effort into this. And therefore, it makes them less well disposed towards it. So make sure it's as clear as it can be. Make sure your meaning's clear, make sure your phrasing is as clear as it can be as well. At this point, it can be really helpful to ask for feedback, but be clear what you're asking for. Are you asking someone to look at the style of the article? Are you asking them to check the wording of particular parts that you're not quite sure about? Are you asking them to make sure that you haven't missed anything obvious in terms of the content? Give someone time to do this. Don't ask them to do it overnight if you know they're busy. Just because you're on a deadline That doesn't mean they are. Give them a copy of the instructions to authors if that would be helpful. And try not to take the criticism personally. You have asked for it. You don't necessarily have to follow it all, but you have asked for someone's feedback on your article. So try not to be too upset if they criticise what you've written. Try and look at that objectively and see how you can use that feedback to improve the article. So now you've come to the point where you can submit your article for peer review. Before you do this, have another look at the instructions to authors and check what the particular journal that you're submitting to requires. Does it need a separate title page? Do they have requirements for fonts or line spacing so that reviewers are able to easily refer to specific parts of the article? Do they need numbered pages or numbered lines? Do they ask for keywords? Do they ask for boxes? Do they have a specific format for tables or figures? Have you followed the reference style that's been stated in the instructions to authors? Is there anything else you need to submit alongside the article? So a covering letter, consent forms, ethical approval. Make sure you have all the information ready before you submit. It will make your submission process much easier. The majority of journals now ask you to submit online, and these processes are designed to be fairly self-explanatory and fairly straightforward for people. So do try and make sure if you've got all the information ready, it should be a fairly straightforward process. So once you've submitted your article for publication, you should receive an acknowledgement email from the journal saying that they've been received. It will usually be given a manuscript number at that point, and you'll get an idea of roughly how long the process should take. We always give that as a guide. Our peer reviewers are clinicians and academics in the field that you're working in, so they're very busy, the same as you're very busy. We ask them to review within 2 to 4 weeks. Sometimes that's possible, sometimes it's not possible. Editors are always aware of articles that are late, so there's a fine line between hassling the editor too much and just following up to see how your article is doing. Most systems you should be able to check online yourself just to see where your article is in the process. So peer review. Peer review is often, but not always, double blind, which means that the reviewers don't know who wrote the article and the authors don't know who has reviewed the article. This is intended to try and remove bias from someone who's working at a competing institution, for example. If you're working in a very, very small field, it might be very difficult to have a fully double-blind peer review because you will probably know the other people who are working in that area, but that's what most journals aspire to. So the reviewers will look at the article, they'll be given instructions from the editor what they're to look for, and they will make recommendations to the editor on whether the article should be accepted or rejected or revised, and reasons why. At MA Healthcare, the majority of our reviewer recommendations are either minor revisions or revise and submit for a re-review. So when you hear back from the editor, you will have a decision on whether your article has been accepted, which is very unusual. Articles are very rarely accepted after the first round of peer review. Occasionally they will be rejected, but that's generally if they're out of scope. And hopefully if you've had some support from colleagues and you've thought carefully about the journal that you're submitting to, your article is unlikely to be rejected. Most frequently, articles are either asked to be revised and then they will be resent back to the peer reviewers for a further round of reviews, or authors are asked for minor revisions. These could range from anything from clarifying certain parts of the article, adding more detail if the reviewers feel that it's not clear enough to readers what you did or which patient group you're talking about, or something like that. They might ask for more tables, more figures, some clarification of what's being done. So usually it's fairly straightforward to see what they're asking for, to make those revisions, and then to resubmit the article. One thing to note is that you don't necessarily have to make all the revisions that are recommended by the reviewers if you don't agree with them. So if you feel, for example, that they've suggested that you look at a different area as well and you didn't include that because you felt it was out of scope or there wasn't room to do that within the word count of the article, for example, then you're perfectly within your rights to explain back to the editor. Don't make the revision, but explain to the editor that you haven't addressed that because you felt it was out of the scope of the article that you've written. They can then take that into account when they look at your revised article. So things the reviewers will be looking for. Are the references up to date? Are they relevant? Have you got all the key research being cited? Does the article add something new to the body of knowledge? Importantly, is it relevant to the target audience? You'd be surprised how many articles we have submitted that are not related to the audience of that particular journal. Does the article have a sound theoretical research or philosophical base? Is it well organised? Are the arguments logically developed? Are the interpretations and conclusions that you make justified from the data presented? Don't introduce a new concept in the conclusions or in the key points that you haven't discussed earlier in the article. Do you include further recommendations for practice? And importantly, and relatively easy to check for these days, is plagiarism. Make sure that you write the article in your own words, that you don't copy great chunks out of other people's work, accidentally or not. That's something that almost all journals will be set up to check for, and will be an immediate red mark against your article if it does fail a plagiarism check. So, as I said, revisions and amendments are the most likely outcome that you'll get from your first round of peer review. As we said previously, it can be hard to take criticism, but reviewers and editors usually have good reasons for suggesting the changes. So consider these carefully and try not to be offended by them. Try to look at them objectively on the basis of what you've written. If there's a good reason you think something shouldn't be changed, then mention that to the editor. Remember, you also have the right to withdraw the article and submit it to a different journal if you really don't wish to make these changes. When you resubmit the article, it's good practice to list the changes that were requested and then the responses that you have made, the changes that you've made or that you haven't made, in a cover letter or a separate document with the resubmitted version. This is a really important thing to do because it really helps the editor and the reviewers to see what you've done, why you've done it, how you've addressed it, and if you haven't addressed things, which will make it much easier for them to re-review your revised article, and hopefully then make it easier for them to accept your revised article. So once your article has been accepted, well done. The next thing that will happen that it will be copy edited. So this process involves making amendments to the grammar and the spelling and making sure the text conforms to the house style. As we mentioned previously, this isn't something you need to know, but it will be something that the copy editors, sub-editors will do. They will also make sure that the meaning of your article is clear to the reader. They will pick up areas where maybe what you've written might be slightly ambiguous, and so they will ask you to clarify exactly what you mean. They'll suggest changes to the phrasing, or they'll query it with you, and then you can clarify that and make sure that the article's as clear as possible for the readers. They will also possibly pick up on minor issues that have been missed by the reviewers. Our copy editors, our sub-editors, our editors in-house are extremely experienced. They're very practiced at editing articles, and their role really is to make the content of the article as accessible as possible to the reader, to make sure that as many people as possible can read and understand and apply the work from your article. So what happens after that? Your article has been published. It'll probably be available online and it'll be available in print. So then, well done. Take a moment. Be proud of yourself. It's not an easy task to write and get published an article in the clinical journal. So well done. Tell your family, tell your friends, tell your colleagues. Make sure you tell anybody who helped you, who read through your first draft, who gave you some advice on the article, and then maybe start thinking about your next article. If you've got any questions, feel free to drop me an email. These are the details for our author guidelines and the details for online submission. As I mentioned previously, if you do have questions about a specific article for a specific journal, then do email the editor. All the details are available online. Editors are always happy to hear from authors. We'd far rather have a conversation with you early in the process and be able to agree together a suitable direction for an article than to receive something and go, oh, that's really interesting, but it doesn't quite fit what we're looking for at the moment. So if in doubt, contact the editor. Here's some information about the company and the journals. We look forward to hearing from you. Thank you very much.